Probably the most influential part of my life happened about 6 years ago, especially towards this current trajectory. I was living in South Africa kind of after college, trying to be a journalist. I found a job and got on my feet and felt like I was kind of making some progress, and my mother called me up and said, "Hey, your father, it's his birthday, and you know, he went to the hospital for a checkup, and they found this problem in his stomach, and they said he has cancer, and he has 3 weeks to live, and you have to come home right away." And it was just kind of obviously dramatic and tragic, and I got on a flight and sort of dropped everything I'd been doing and came home. And we lived in this old house in Poughkeepsie, New York, one that was from the 1890s. And it was kind of in disrepair, and my dad had been kind of working on it a little bit, but hadn't really gotten around to finishing it. And while he was in the hot of restoring, or trying to restore the house that we'd kind of grown up in, and in the process of doing that, found out all this really interesting architectural history of the house. It was built by this famous architect that built the Philadelphia Art Museum, for example, and actually Harvard Library. His name's Horace Trumbauer. And I found all this sort of interesting history of the city, and I started to work on it. And in those 3 weeks, my dad kind of survived those 3 weeks and lasted another couple weeks, and then he started to actually get a little better. And slowly, over the next month, and then 2 months and 3 months, my dad's health kind of really began to restore, and so too did my house. And then we were this kind of working in tandem, and there was this real sense of kind of ownership and pride over kind of putting the effort into kind of building this house anew. And suddenly, you know, a year and a half passed, and my dad is almost kind of, much healthier and really is fully back at work, and so too is our house restored, and he was sort of working every day when he got home from work with me on restoring it. And it became this sort of, I kind of had to reflect on it and think about it, and I said, you know, this is amazing. You know, our homes, the places we live, and our places of where we exist have a great impact on our lives personally, and commitment to them, to changing them, to affecting them for the better, can actually change our lives as well. It can actually have a great direct impact on our lives as people. It was because of that I decided I think architecture was really where I was meant to be. It was, for me, also that kind of commitment to the personal also has a great public impact as well. And so I bring that kind of ethos, or at least I think like most architects now, I think believe that architecture makes a difference on people's lives, and certainly that personal experience has driven me to think about that as I work in the future. In terms of my design sense, I would say the house itself also has informed me. I mean, it's part of the arts and crafts movement, and the arts and crafts movement is very influential to us as architects, especially theorists like William Morris, who started the arts and crafts movement in the UK, and really spoke about how the craft, the commitment to craft, the commitment to labor, and the construction of objects. It's the process of construction that makes things beautiful, and the commitment to building a political movement around that, around those laborers, around those crafts workers, is perfectly aligned with the construction of architecture, so that, you know, the political life and the social life are directly part of the beautiful life. And William Morris very much theorized that in the 1880s, around the time when a project like our house would emerge in that same movement. We're a nonprofit architecture company, and we are focused on showing how the built environment has a direct impact on our lives, and especially on our health. And so not only through our built work, but our practice model, as well as the way that we think as designers, we want to show those direct relationships, those direct impacts that our architectural and design decisions can have on improving people's lives. Our Batara Hospital would be kind of the best example of what taught us the most about where architecture could go. In that project, I would say two things emerged where I think for us have really shaped a firm in order to accommodate harder questions than simply what, you know, architecture can do, or what is architecture, but like how does architecture perform, and also how do we build a practice model about a different type of performance. First, as I mentioned before, what are the direct impacts of the building or the facility on people's lives? And in this scenario in particular, we saw that the buildings of, especially resource-poor settings, but definitely here in the U.S. in terms of hospitals, many people are getting sicker when they're going to hospitals than getting better. There's something like 100,000 deaths a year from hospital-borne infections in the U.S. When you take that to resource-limited settings where facilities are barely designed, if designed at all, to the climate or the conditions of those communities or those sites, this has amplified the diseases that are emerging. So multi-drug resistant tuberculosis, you have kind of 19th century diseases, and then sort of more virulent strains of those diseases emerging because of, or in many ways, because of a lack of design or lack of architectural thinking. So MDR-TB, multi-drug resistant tuberculosis, for example, emerges in spaces where there's no ventilation. A sick patient will walk into a clinic next to someone with a broken leg, and the person with a broken leg could very much contract that tuberculosis by just sitting next to them. And we can solve that if there's enough ventilation in the room, but because we hadn't thought about those problems in those certain climates with those specific diseases that the patients might have, it's making the problem worse, and potentially it can cause a global epidemic. And so you have this crisis that is directly related to the lack of infrastructural thinking, a lack of building or facility design, and simply better health programs are not going to solve that alone. Certainly it's a key piece of it, but the facility is also a piece of that program. And so when we saw buildings that were making people sicker, we also thought, could buildings make people healthier? Could they be designed in such a way as to improve health instead of just be a shell in which healthcare is provided? And so that's very much what we were sort of tasked to do in Rwanda with the incredible leadership and guidance of the organization Partners in Health, which is an inspirational organization, and its leader, Paul Farmer, has really been a mentor for us to help us think about the deeper implications of what it would mean, what it would cost to actually not have design, what are the costs of not having architectural thinking on a project. And so by asking those questions, we're able to, first of all, design a facility that performs in a different way than, say, typical resource-limited health facilities. But secondly, and just to back up, that's how the hospital is working. We're getting enough air changes per hour to reduce infections radically using just natural ventilation systems, no imported HVAC systems. So that kind of innovation emerged out of that simple question: how can buildings make us healthier? I would say the biggest lesson I learned is that shovels in the ground is about 70% of the problem. Just get it done, get started, put the shovel in the ground, and things will occur, things will happen, things will get going to help finish it. It's a big hurdle, is that initial anxiety, being able to prototype, failing, being able to solve those problems and getting up again. Design, I learned this from Tim Brown, the director of IDEO, or president of IDEO, told me, sometimes the thing that we design is actually just a tool for which we find the actual problem we're seeking to address. And that it's an iterative, cumulative process, and we have to focus on that process instead of focusing on the object. And I would say that's probably the other major lesson that I've learned in this effort in working, having the great privilege to work on these projects, that it's designing the process which is most important instead of designing that final product. It's partnership which makes this possible. It certainly is not a vision of one single person or entity, but it's a cumulative, I think, collective vision of many stakeholders which would allow something like the Bitara Hospital to emerge. Partners in Health, their affiliate organization in Rwanda, the Rwanda Ministry of Health, visionary leaders like the current Minister of Health, Dr. Agnes Binagwahu, and the Rwandan project manager, Bruce Nizeye, who ran the construction. I mean, these people were driven by something much bigger than themselves to do a project like this. And I say I learned everything I know about architecture from Rwanda. I mean, I feel like it's true that the way to build is not just you don't have one isolated responsibility. It's a responsibility of a collective team. And Partners in Health, I think, teaches us about that it's about distributing that weight, but also expecting more from every part of that organization, of that collective team, in order to get something really visionary completed. And we were very humbled to be a part of that project in Rwanda. So one thing I've really learned is remembering that it's, in all these products and all these designs and all these efforts, it's labor that puts them together. It's people's hands that ultimately are constructing these things. If it's from, the factories in Apple to the site workers in Rwanda, people's lives are at stake with the decisions that we make. And it's, I think, always going to be valuable if we can tie that long, even if it's incredibly long, string together, and remember that specific decisions that we make as designers, as implementers, as policymakers have great impact on people's lives down the line. And the more that we can remember that, the better I think those decisions could be to have a better and more global impact on people's lives.